In bipolar affective disorder, someone will have episodes of depression and may also have episodes of elation. Now, the features of the depression are very similar as to when somebody has a depressive illness, with changes in sleep, appetite, interest and enthusiasm and enjoyment in things. The episodes of elation, though, are much more difficult for people because sometimes the person may not actually recognise that they are unwell because they have a sense of well-being. But that's not always the case. When someone is elated, they tend to have more energy, they don't need as much sleep, they may speak more loudly, their thought processes are speeded up, and they may make decisions and their behaviour may be out of character and that they may be more reckless than they would be in normal life. Bipolar affective disorder can be categorised into two different types, bipolar 1 and bipolar 2. Basically, the difference is that if someone has a bipolar 1 illness, the episodes of elation tend to be more severe, whereas in bipolar 2, the episodes tend to be milder, so like an exaggeration of good form. And both bipolar 1 and bipolar 2 can be either normal cycling or what we call rapid cycling, in that somebody can have a number of episodes in a 12-month period. If you think you have bipolar disorder yourself or someone close to you has bipolar disorder, I think it's really important to talk to your GP and find out as much information about bipolar affective disorder as you can. But there's lots of information readily available, including information on the Aware Defeat Depression website. Once you understand more about bipolar illness, it gives you a greater insight into how you can manage the illness if you yourself have it. Your GP is going to be the person who is going to help you manage that. Your GP, for example, may suggest that you see a specialist mental health professional, a psychiatrist or community psychiatric nurse, who in turn may suggest that you start on a mood stabiliser, which is a particular type of medication which helps reduce the likelihood and intensity of both the depressive and elation phases. While we know that medication is very important in helping people with bipolar disorder, it's also really important to look at the self-help strategies as well as talking therapy. And there's an increased evidence about how cognitive behaviour therapy can help people with bipolar affective disorder. And certainly in my clinical practice, I encourage people to look at identifying a well-being plan so that they can start looking at things that they know may lead to them becoming either depressed or elated, and look at how they can manage those, and building in sort of safety nets in their day-to-day life. Some people who have bipolar affective disorder will be prescribed lithium. It's one of the commonest used mood stabilisers. Now, how does it work? Well, lithium has been around for over 50 years and we actually don't know exactly how it works, but we do know that it has a stabilising effect on both the elations and depressions. It's a very safe medication when taken properly. When someone starts on lithium, it's likely that they're going to have blood tests very regularly, possibly every week, until the lithium level is at the correct level for them. And even after that, it's really important that the lithium level is monitored on a regular basis, and your GP or mental health professional will advise you about this. If you find that you're not able to tolerate lithium, or if you're still becoming unwell in lithium, talk to your mental health professional, because there are lots of other medications, other mood stabilisers, and increasingly we're using some of the major tranquilizers which also act as mood stabilisers.